As temperatures rise globally, the impact of climate change on the transmission of vector-borne diseases such as malaria become increasingly evident. Mutai, an old farmer, recounts his recent diagnosis with malaria and the challenges faced by those seeking treatment.
Nilipofika hospitali sijui vile nilifanyiwa, lakini nilichukuliwa kipimo.
I was taken to hospital. When I got there, a blood test was done and I was tested positive for malaria. But the hospital didn't have any medication. I had to look for a doctor who could treat me at home. In response to the escalating impact of climate change on disease transmission patterns, the International Livestock Research Institute and the Kenya Medical Research Institute have collaborated with the Zoonotic Disease Unit to study the effect of mosquitoes and disease transmission.
The reason why we've set up a weather station in this area to be able to capture the different environmental conditions like temperature, like humidity, like wind speed and wind direction, to be able to really relate how these different components of climate could be influencing the population of vectors and also could be influencing the disease trends that we are seeing around here. So other than the weather station, we are also trapping mosquitoes in this region, and we are monitoring the population of mosquitoes during different times of the year. We are monitoring the pathogens that the mosquitoes are carrying.
The Horn of Africa, including northern Kenya, has experienced destructive floods recently, contributing to stagnant waters that become breeding grounds for mosquitoes. A senior advisor of the Kenya Malaria Council linked the heavy rainfall to an increase in vector-borne diseases like malaria.
With increasing temperature, with increasing amount of rainfall and humidity, there is more breeding. There are more breeding sites, and there is therefore a high chance of transmission of vector-borne diseases like malaria, like dengue, like Rift Valley fever, and chikungunya.
The WHO's 2023 malaria report highlights a concerning trend with an estimated 249 million malaria cases worldwide in 2022.